Hey everyone, this is Dr. Ruscio, and I wanted to share with you some interesting information on SIBO and its potential to cause weight gain and SIBO's treatment's potential to yield improvement in your metabolism and potentially weight loss. So if you're not familiar with SIBO, really briefly here, SIBO is small intestinal bacterial overgrowth. It's a condition where you have overgrowth of bacteria in the small intestines that can cause gas, bloating, abdominal pain. It can cause loose stools or diarrhea, or constipation, or a mixture of the two, depending on the type of SIBO or small intestinal bacterial overgrowth. Now, how does that pertain to weight loss? And I don't want to get pulled into a gimmicky weight loss sort of discussion here, so I will tell you that this is not going to be the next huge breakthrough where people are going to be dropping 100 pounds left and right, in my opinion, but I do think it has the potential to yield some nice weight loss. And at the end of this video, where we'll discuss a little bit of the science, I sat down with a patient who recently had this presentation and lost 53 pounds, 25-ish I would attribute to her diet, and then I think the other 25 were probably from this presentation. So essentially, what we think happens when we have a certain type of SIBO is it can affect energy harvesting or energy absorption in the gut via modulation of the gut bacteria. And specifically, what seems to be able to happen is when hydrogen producing SIBO starts to overgrow, and that is accompanied by methane producing bacteria. So when you have both types of SIBO, and just to clarify, there are two types of SIBO. There's a hydrogen SIBO, there's a methane gas producing SIBO, so hydrogen and methane being the gases that we test for on the breath test we use to diagnose. So when you have both of these gases elevated, that has been correlated with obesity. So let me show you a few slides here. These slides are from the SIBO symposium that was hosted at Cedars-Sinai Medical Center in 2014, courtesy of Mark Pimentel and his group. Now, what you're seeing here in the first slide is looking at methane, so the methane gas in obesity. So what you're seeing in the yellow box, that's the BMI or body mass index, or just your height to weight ratio of all patients. Then you're looking at, in purple, the BMI, or the average height to weight ratio of those with no methane production. And then, and this is where we see the interesting finding, when you see a positive methane, those subjects, when we allocate those subjects into one group, we see that their BMI goes up quite remarkably. And so these people are, for every inch, they are significantly heavier. So we're seeing there from a crude analysis perspective that people tend to be quite a bit heavier if they have this positive methane. Now, the second slide I think is what's maybe more important, because it's one thing to take information from an obese population, and it's another thing to have information that can help maybe people who have a little bit more of a common weight loss, not to take anything away from obesity, but there's a higher amount of people that have a lesser amount of weight to lose. So there's more people walking around that have 10, 20, 30 pounds to lose rather than 100 plus pounds to lose. That's what makes this slide interesting. Methane in non-obese patients, patients who are overweight but not obese, and you see the relationship here is also reinforced. So it's not just something that only happens at the extreme endpoint of obesity. There may be the ability to get a marginal weight loss attributed to treating or clearing of the SIBO. And the final slide here, you see that when methane SIBO is eradicated, according to these study results, you see a drop in both total and LDL cholesterol and a slight improvement in insulin sensitivity. So this is, what we're seeing here essentially is a improvement in metabolism, and it's been speculated that this may really have benefit to be able to garner weight loss. Now, here are your references for those few slides that we went over, and if you look in the description of this video below, you'll see a link to another video where I sat down with a patient recently that had this hydrogen and methane positive SIBO. We treated the SIBO as well as put her on the autoimmune paleo diet, and she lost 53 pounds over the course of maybe 4 or 5 months. And we discussed her experience and how her gastrointestinal symptoms improved, like constipation and bloating, but also we saw this weight loss, and this weight loss that seemed to be more than I would typically anticipate with the just using the paleo diet alone, even though I think the paleo diet is fairly remarkable for achieving weight loss. So in recap, small intestinal bacterial overgrowth can cause gas, bloating, loose stools, diarrhea, or constipation, or oscillation between the two. Maybe 80% of IBS, which is what those symptoms encapsulate. And a certain type of SIBO has been associated with weight gain. Treatment of that SIBO is starting to be associated with improvement in metabolism and potentially has the ability to yield weight loss, as has been speculated medically, and also I've seen in the clinic recently with a patient that I've treated. To test SIBO, you can do simply a breath test, a lactulose hydrogen methane breath test, and treatment can be achieved with either using an antibiotic or herbal antimicrobials, although it's a little bit more detailed than that. I wanted to just give you some basic guidelines if you're not familiar with it. So anyway, this is Dr. Ruscio. Hopefully this was helpful, and look at that link in the description below that will take you to the video where I sat down with a patient and discussed her experience. Okay, hope this helps. Thanks, bye.